So I see a lot of patients who are sent over who are self-referred for noticing blood in the stool. Obviously, if this is not something you deal with on a daily basis, it can be a very scary sight, especially if it's the first time you experienced it. I think the most important thing to know is that almost always it's usually a benign finding, and it's not something to worry too much about. There's two different types of blood you can see in your stool. You can see either bright red blood or dark blood that looks like it's really just mixed in with the stool. Those can indicate what actually is the cause. Typically, when it's brighter, we think it's more from hemorrhoids or lower down in the large intestine or colon. If it's darker blood, that can be coming from higher up in the colon or large intestine, the small intestine, or even from your stomach sometimes. When you see a primary care provider or a colorectal surgeon about this, other things you want to try to think about are, is this causing you any pain? Is this causing you any swelling? Is this causing you any discomfort on a daily basis? How frequently is it happening? Is it happening after bowel movements, on the toilet tissue, in the toilet water, or is it just kind of happening sporadically throughout the day? Have you changed your activity level? Have you changed your diet? Have you changed for any new medications? Most of the time, again, this can be reassured that it's usually just hemorrhoids or some type of benign anorectal disease. But if you are within the screening age for colorectal cancer, which is now 45, or have some type of family history, this should be evaluated most likely with a colonoscopy to ensure that there's nothing else going on, although that is very rare. Even if you're younger than 45, if you're having significant bleeding and we can't attribute that to something like hemorrhoids, something to consider is a screening colonoscopy, just to make sure, because if there is something going on, we want to make sure we catch it early and we can treat it early and have a much higher success rate.